Today we're talking about microneedling, and we're going to talk just a little bit about what is microneedling. Microneedling requires some topical anesthesia first applied to the skin so that you're comfortable during the procedure. And then basically what we're doing is we're essentially poking very fine holes into the actual skin itself. And by doing so, we're stimulating collagen. So stimulation of collagen then will improve texture of skin. So improvement of texture means improvement of lines, wrinkles, things like acne scars, improvement of pore size. So these are all things that we want to see and we get questions about from all of our patients. Another thing that we get lots and lots of questions about are things like skin pigmentation, especially melasma. That's a huge complaint from our patients, especially as we near summertime. We get a lot of questions about how can I treat my melasma? And really, the only thing that I like to use treatment-wise during the summer months, the warm months of the year, is the microneedling technique. I find that when you get into the hot summer months, there's really no reason or need to treat with the laser and light devices, the ones that produce heat and light energy. And so the microneedling device gives us that wonderful non-heat or non-energy based technique, and it's really a wonderful technique for the melasma patient. So we have the what is it, and now we have the things that we can use to treat for the microneedling device. Next, we need to talk about things that we want to use after we do the microneedling. So we want to apply things into those nice little holes that we've created, or channels in the skin. And the most commonly used item that we apply is platelet-rich plasma, or PRP. That's something that we actually draw from your own blood. We spin that down, and now we apply it directly to the surface. It does one of two things. One, it creates a better outcome for you as the patient, and two, it actually speeds up your recovery time. And then the other type of topical that we can apply is something called exosome therapy. Exosomes are actually created from a frozen concentrate. We achieve that by then applying that to the surface of the skin. And exosomes are basically very, very tiny items. They're creations from a donor, and they contain messenger RNA and growth factors, and they're consistent in that they then create sort of a template for the cells that we're trying to achieve, again, back to collagen stimulation, so that then that creates DNA that then can create new collagen. So that's another marvelous approach to generation of new cells, and it's a much, much faster approach than platelet-rich plasma. So exosome technology, or PRP, and it's almost a mandate to microneedling because you want the best outcome, you want the fastest recovery. Doing microneedling alone does achieve some level of success, but by adding that additional step on top of that additional topical, that's where the magic really happens. And so that's why you want to do microneedling plus something else. And then finally, once you're done with the actual treatment, you're going to be very, very red, or what we call in the field erythematous. And so you'll want to then go down to what we call our finishing touch room, and that's where I'm sitting right now. And our experts will basically camouflage that redness so that as you walk out the doors of the clinic, no one will be wiser that you had any kind of treatment done. And we'll teach you that approach so that as you leave your home for the next couple of days post microneedling treatment, you're going to look just as normal as you look every single day, so that no one will know that you've had a treatment done, but all the while your collagen will be continuing to be stimulated, and you're going to be having that wonderful treatment success that you're looking for.